Guys, it's probably true that you've heard at least the phrase scoliosis. What is it? It's a curvature of the back. But why does it happen and how do we treat it? That is a question for Hima Dalal. Hima Dalal, Integrative Health. Thank you for coming in.
I'm very happy to be here with you today.
Of course. So let's talk about scoliosis. It's an unnatural, obviously, curvature of the back, of the spine.
So spine naturally have a S-shaped curvature,
Right.
but that's front to back.
So
When
it
that
does
curvature
this, so it's like
starts
here.
going like this,
Right.
sideways, so upper back is here, lower back is this way,
Sure.
and you start slumping like this,
Okay.
that's scoliosis. Now it can be in your neck, it can be in your mid-back, it can be in your lower back. It can be the newborn baby trying to come out of the mother's womb,
Right.
can get a kink in the neck,
Like a
and
little
it
kink.
stays, and if it's not treated early enough, it can become
Sure.
a problem.
I
So-
remember having, like, with doctor, you'd bend at the waist and the doctor would check your curvature of your back.
Correct. And
prison.
it can be postural, it can be congenital, it can be injury, it can be just the aging. So
Right.
from newborn to aging population, anyone can suffer with that.
So you can
Adolescent,
develop it over, you can start out fine and
Right.
then at 40, 50, 60 develop scoliosis.
the young adults are very much at the risk because of the posture, because of the wrong way they sit, use so much digital media stuff, and it can become imbalance in the muscle,
Okay.
and you can create that.
Now, how do you combat it? Can you fix it? That's the question.
Yes, most of the time, even if it's congenital, even if it's a deformity, it can be improved. Muscle imbalance can be improved with a trained therapist who is very much aware that how to evaluate them, how to see where they are. If it's a fascia restriction, myofascial release technique that I've developed can definitely help tremendously. But some exercises are very powerful too as a home tool.
Right.
Mindfulness meditation to change the mindset, because again the muscle memory is very powerful. If you don't change the muscle memory, nothing will happen. You can you can go to as many therapists as you want. You can, and then what happens? The population starts taking chronic
Medicine.
pain medication,
Yes.
and you see the downfall of the chronic pain medicine. So it's very much important that you learn the self-care. You learn the body mechanics. You learn how you sit, how you stand. See how well you're standing?
Every time I talk to you say that, I find myself kind of correcting my posture. Whenever you mention that word, you're here with us. I'm like, what?
No, but and can you see, I'm born with scoliosis, but we have combated that with all the tools that I have in my toolbox.
Right.
And you can avoid pain, you can avoid the self-image, of course, right? When you are not, and then risk of fall is so much higher in.
There's a lot to it.
And then sports people, oh, they will perform with their skill, but then they will not be consistent. And breathing is the biggest issue that scoliosis people suffer with.
All right. Remember links at abccolumbia.com to Hima. Talking about scoliosis treatments, it's not necessarily something you can't deal with or can't, clearly live with if that's
Yes,
the case. So
don't suffer.
thank you very much for coming in. Stick around, guys. We're coming back.
Thank you.